Hello and welcome to this e-learning resource on simple steps to take care of your residents' dental health inside the care home setting. This section will look into the best ways of taking care of the remaining teeth of your residents. Recent studies have revealed more about the best ways and times to brush teeth to keep them healthy and free of decay. This can dramatically improve the quality of life for residents and ensure that they will not be affected by unpleasant toothaches. The ideal steps for good toothbrushing can be summarized as the following: using the correct type of toothbrush and toothpaste, brushing them at an angle towards the gums, encouraging your patients to spit but not rinse their mouth after brushing, and adapting the toothbrush accordingly if your patient cannot hold it properly. There are a number of toothbrushes available on the market, and it can be difficult to tell which one is the best for your patient. Generally speaking, a toothbrush that has soft bristles, a small brush head, and bristles that are not worn away are generally good choices. If you notice that the bristles on your patient's toothbrush are worn away, such as those shown here, you should replace it with a newer brush head so that the brush will be able to do a much more effective job. Or, if the patient's using a manual toothbrush, replace the brush entirely. Selecting the right toothpaste can seem similarly confusing given the sheer amount of options available on the market, but you can select an appropriate one with one simple rule: check the fluoride content on the ingredients of the toothpaste. 1450 ppm, as shown here, is seen as an ideal level. How to brush teeth effectively. Apply roughly a pea-sized amount of toothpaste onto the brush, without wetting the brush before applying the toothpaste. Only wet the brush after you've put the toothpaste on it. When brushing the teeth, the brush should be held at a 45-degree angle down towards the gums. This helps the bristles get underneath the gums, improving the degree of cleaning that is actually performed by the brush. The brush should be moved in a circular motion so as to get the maximum amount of cleaning possible. And the tops, fronts and backs of all the teeth should be cleaned, as decay can affect any one of these surfaces. This should occur all around the patient's mouth, ensuring that all of the patient's teeth are cleaned adequately. Brushing with an electric toothbrush is performed in very much the same way, the only difference being that you don't have to move the brush in the circular motion. Rather, you hold it against the tooth, as the actual movement of the brush itself will clean the tooth for you. Using a circular rotating head with your electric toothbrush will give the ideal degree of cleaning. Once you finish brushing the patient's teeth, encourage them to spit out the excess toothpaste, but to not rinse their mouth out with water after you're done, as the longer the toothpaste remains on the teeth, the more effective it will be at preventing them from becoming decayed. For the best possible effects, the teeth should be brushed twice a day. It is crucial to brush them last thing at night and at least one other time during the day. When they are brushed, they should be brushed for around 2 minutes each time. It is also important to avoid brushing the teeth directly after the patient has just eaten. This section will look into the best ways of taking care of patients' fake teeth, aka their dentures. It is just as important to care for the cleanliness of dentures as it is for teeth. Studies suggest that dirty dentures can lead to significant health problems such as pneumonia. Denture care does slightly differ from tooth care, however. There are many different types of denture available. Some clip to remaining teeth in the patient's mouth, whereas others replace all of the teeth if the patient is missing all of their teeth entirely. Some dentures are made of metal, whereas other dentures are completely made of plastic. Generally speaking, these dentures are cleaned and treated in very much the same way, with only minor differences between the two. Much like with teeth, it is important to brush dentures to make sure that these remain clean as well, as plaque and bacteria can get onto a denture just as easy as they can get onto a patient's teeth. Generally speaking, dentures should be brushed at least once a day using unfragrant soap and water. It is very important to not use toothpaste when brushing dentures. Dentures should be brushed with an appropriate toothbrush or denture brush. And when they are being cleaned, it's generally a good idea to clean them over a half-filled sink, as dentures can, of course, fracture if you drop them. If you drop them into a sink full of water, they're much less likely to break. It is important to rinse all of the soap and water off of the denture after you're done cleaning it. Finally, it's also a very good idea to encourage your patients to take their dentures out overnight, as this allows their gums to have a rest from having the constant pressure of the denture applied to them in the day. Dentures are usually designed by the dentist so they can only be put in and out of the patient's mouth in one way, so it is important to not try to force the denture off, but rather gently pull it in the correct direction. Gently rocking the denture will also usually help you get it free. Here you see me using a standard toothbrush, very similar to the type of toothbrush I recommended for brushing the patient's normal teeth. Of course, it's generally a better idea to use a different brush to the one that the patient normally uses for their teeth for cleaning their dentures, as this brush is going to get covered in soap. You clean the denture all the way around using the brush on the inner surface and the outer surface of the denture. You'll also notice that I'm cleaning the denture over a half-filled sink. Note that when I drop the denture, it doesn't break, as the water catches the denture and protects it. Brushing a metal denture is done in exactly the same way, again using a standard toothbrush with soap and water to brush all of the surfaces of the denture. It is also recommended that at least once a week you leave the dentures overnight in a cleaning solution in order to clean off any bacteria that you can't quite get off with the brush. Of course, the denture should be cleaned as normal with a toothbrush and with soap, but the soap should be rinsed off before putting the denture in the cleaning solution. The cleaning solution should be an appropriate choice, and this differs slightly between metal and acrylic dentures. For plastic dentures, most denture cleaners that you can buy in the supermarket, such as those on offer from Steradent, can be used effectively to clean these. These cleaners usually come in the form of a tablet that you can dissolve in a glass of water, like so. Please note that it is absolutely essential that you do not use bleaching products to clean dentures, as these can cause significant damage to the denture. Place the denture in the glass once the tablet has fully dissolved. Leave the denture in the mixture overnight, and then, the next morning, make sure that you rinse all of the solution off of the denture before the patient puts it back in their mouth. This is different for metal dentures, however, as most cleaning agents will damage these dentures. A suitable alternative is to use Corsedil mouthwash to submerge the denture overnight in. This will not damage the denture and will also eliminate most bacteria. Just like with plastic dentures, metal dentures should be left overnight in the solution and then taken out the next morning and cleaned thoroughly before being given back to the patient to put back into their mouth. Please note that dentures still need to be checked by the dentist just as regularly as normal teeth. So why is oral care important? It isn't just about keeping the teeth healthy and clean, it's also about maintaining the overall health of the patient. Having strong pain-free teeth allows a person to eat and drink healthy amounts, but it's also worth mentioning that poor oral hygiene can lead to a number of health conditions, including pneumonia. This is why maintaining good, healthy mouths is crucial for your care home patients. Diet forms a crucial part of looking after a patient's teeth. Recent evidence suggests that the frequency at which the patient has sugar is much more important than how much they have. What that means is that limiting the amount of times someone has sugar in the day is more important than limiting the amount of sugar they have. The key point here is that a patient should not have sugar more than 5 times in a day. Saliva, or spit, has a very important role in maintaining the health of the mouth. Saliva is important for speaking and swallowing properly, protecting the teeth from sugary attacks, and helping to keep a patient's dentures in place. Some patients, however, do not produce enough saliva, and this is known as dry mouth. Residents at risk of developing dry mouths include those who are taking a number of medications, those who are very frequently dehydrated, or those who have complex health problems such as diabetes. You can help patients overcome the difficulties of having a dry mouth by encouraging them to have regular sips of water, asking their dentist about saliva substitutes or high-strength toothpaste, or providing them with fluoride mouthwashes. If a patient has been prescribed a high-strength toothpaste by their dentist, it's very important to not mix this up with other toothpaste or give this toothpaste to any other residents. Thank you very much for listening, and we hope you find this video useful in helping you care for your residents.